the first installment of Prespero's Procurement in the News, where we discuss noteworthy and recent events relevant to procurement and the Prespero platform. I'm Don Searing, and I'm here today with my business partner, Matt Searing, who's the COO of Prespero, to talk about a relatively interesting case that's been in the news for the past couple of weeks. Matt?
Yeah, thanks, Don. It involves bankruptcy and a company, basically their platform potentially leading this company into bankruptcy, and then the lawsuit involved around that. So Astria Health selected Cerner, their electronic health record system, and they also have a healthcare cloud-based IT platform called RevWorks. And it was designed to support their digital records of patient health history, including clinical and financial data. It would carry out the revenue cycle management, including billing, claiming, processing, and collecting. And they went out to bid and got it and implemented this in January of 2018. It didn't go so well. So once it was implemented, so in 2018, it caused the AR to be trapped and not processed, which is a huge deal for this hospital. It resulted in serious cash collection issues. Now, right before they selected Cerner and implemented this platform, they had previously bought some additional hospitals, so they were relatively probably cash strapped. So collections was a huge issue and extremely important to them.
Yeah, and especially if they're not getting any revenue, right? If your revenue is trapped, it's not even collections; it's just getting the bills paid.
Yeah. Prior, I don't know the reasoning why they switched. I'm assuming it was because this was more modern, I don't know if there was a process that like a sandbox where they ran this through and it seemed fine. But apparently, once they implemented it, their collections were 97% of their net revenue, and once it implemented, it dropped to 54% of net revenue. So that's a 43% drop.
Yeah.
And
I mean, and this is the area. I mean, just from a healthcare standpoint, this is the area where a lot of these hospitals and health systems have quite a bit of ground to catch up on, right? With a lot of the changes to Medicare, or the CMS and Medicare have dictated, this idea of shifting to using purely electronic medical records, right? You have to have a system that links everybody together, allows you to enter in the information to the medical records. And the natural progression of that is, okay, once I have it entered in, can I process that transaction? The doctor saw somebody in the hospital. Can I process all the codes and things that got logged for that transaction? And I can generate a bill right from there by running that up against essentially the master charge catalog. So that whole process of making sure the information gets tracked about you as the patient, and then turned into a bill, and then turned into cash, which is at the end of the day what you want. That's tying that all together is actually a relatively recent kind of concept. And that's where these systems like the ones from Cerner can theoretically help a health system, especially if you're growing like that, bring all that into one system, give you one spot where you can track all of your revenue. Now, of course, that's the downside too, right? It gives you one spot where all of that revenue goes through. And if it's not built right or it's not implemented right, that you could lose, like this company, you could lose half of your revenue with a snap of the fingers, right? A push of a button, turned it on, and this information gets trapped. And maybe, it isn't just necessarily that it's trapped in limbo in the system and it didn't get out. These systems are coding those procedures. So looking at the procedure and deciding what to bill for it. And depending on how it does that, right, that's an art, right? How you do that. There are rules that go into that. And one of the things a hospital can do is write off the charge, right? So if you did 5 or 6 different treatment options, right, and 5 or 6 different codes got entered in, you might know that Medicare doesn't pay for all of those if they come together. And you may want to adjust the codes, or you may want to make sure that you're following the standard practices of Medicare and just bill for the set code and then just write off the other bit, right? So if you look at your, you see, everyone's seen that, you get your explanation of benefits and you look and the doctor says this costs $700, but for your insurance company, it's only going to be $200, and then your insurance company paid $180 of it, and you owe your $20 copay, right? What happens to that $500? It gets written off.
Yeah.
So if this isn't done right, it's not that you're just like, you forgot to call people or didn't generate a bill. You literally are writing off money that you may be owed
Oh,
and that
yeah.
shouldn't have been written off, right? So it might not just be something that they can even go back and just like reissue the bills and recover the money. This might be something that's literally lost. That just got
Yeah.
written off as a loss.
And I'm assuming, since they implemented January 2018, by 2019, Astria Health filed Chapter 11 bankruptcy and were forced to close that medical center that they bought. They actually had to end up getting rid of that or closing it. And they just recently, I think in the last month, filed a lawsuit against Cerner saying they intentionally misrepresented its product and services capabilities, features, and pricing. I mean, I'm assuming within that year, they couldn't just shut it off. Like, oh, we're going to turn off the EHR and go back to the old system. I'm assuming it's like, we've gone this way.
Yeah.
And they
You
have
got to
probably,
fix it, or
yeah.
or you got to roll out a new software or something.
Yeah. And you had, I'm sure those 12 months they were scrambling, and there was probably people, stressing about this, because you basically, this product forced a health system to go bankrupt. So this is why we stress, like, you got to get the software right. The procurement's got to, you got to do the RFP. Everything's got to align and not have, we're trying to prevent these failures. And here's a real life failure that harmed a health system, caused them to go into bankruptcy.
Well, and I know people look at, when we quote these statistics on our website and in our process of it, hey, the large majority of these projects fail. And I think a lot of people, when they hear that, think, oh, that's us, that's somebody building software, right? They went out, they built software and it didn't work. There were too many bugs, it cost too much money. And not this concept of, we bought something from a known name. This is a vendor that's out there. Cerner is a big vendor in this space, right? They bought something that is a product on a website that is offered by this big company. I'm sure they're paying millions of dollars a year for licensing this. Well, I guess before they went bankrupt, they were probably paying millions of dollars a year.
Yeah.
And I think I saw too that like Cerner is countersuing them because they're saying that you owe us the licensing for the platform that we provided that doesn't work. And
because you to go bankrupt. Yeah.
And this is where again, did it work? Did it not work? You can say this, like, you asked the question at the beginning. When did you know it wasn't working? Like, did you not test this and put it in a test environment and say, let's run some bills. Let's go back and maybe take, sometimes we'll do this. We'll take some historical data. Like, let's run the last 6 months of data and see if it generates the same kind of bills that we would expect. And then if it does that, you feel, okay, it's likely to do it right for the next 6 months before you literally flip the switch and cut everything over. And that's where, I don't know what they did. So, I mean, there's a lot of, I'm sure there's a lot of blame on Cerner, and I'm sure this will all come out in the court case. But you can't, as the buyer, you can't wash your hands of it, because however you chose this person, it didn't work, right? You found the wrong kind of partner. You bought software that apparently wasn't as ready as it might have been. And maybe you didn't notice other things. Did you do your due diligence and look back and see, has this software been implemented successfully somewhere else? Are there any other places where there's a problem?
Well, that's the thing. Like, you could say, well, maybe this is a one-off. Maybe this hospital their system just didn't integrate well. But if we were looking out there and they were saying there's since 2017 and 2018, there's multiple lawsuits claiming pretty much the exact same thing against Cerner. And there's a report that went out in 2019, and 70% of clients said they would not buy the platform again. And this is Cerner's platform.
70% of people said they wouldn't buy this again.
Yeah, if you would have done your due diligence, and even if you called and reached out to other hospital or health systems that were using this and asked, how do you like the system? And if you did it not, hopefully you did a big enough, pool to draw from, maybe you would have seen some of these issues. But there you go. Maybe they relied too much on their vendor selection consultant that maybe didn't do the full due diligence, right? Maybe they looked out and they, like we talked about, maybe they started this with a Google search. Maybe they were using Cerner for something else. Maybe one of the companies they bought, one of the health systems they bought had a Cerner platform that worked for them. Somewhere along the lines, there was a disconnect, right? They didn't look at the feedback, right? And part of this is exactly what we're looking at in the Prespero system.
giving you one place where the information about your product, the feedback about your product, your communications, and detailed information about the product, in to the level of answering RFP questions, that information is all in one location.
Yeah.
And you can kind of use us as a trusted source for the right kind of information about this. And yeah, I could, you could fault someone. Maybe when you do due diligence, maybe you didn't do the right Google search, but I don't know how they wouldn't have done that, because I'm sure if you type in Cerner, the name of the platform, and lawsuit, it comes up with other lawsuits. And I think we've done that, and that's exactly what happened. So you're wondering, like, where was the disconnect in this? And and the lawsuits were already filed before the purchasing process for this, so they were there. And the 70% number, I think, that that come from an analyst.
Yeah,
that's an analyst report.
Yeah, KLAS report. Yeah.
So like that's another known area. So you start to ask the question of, how are you bamboozled, right? How did you not find this information? But that being said, these are complex processes. There's a lot of decision makers that go into this. Implementing a system like this touches doctors, administrators, the finance part of the hospital. I mean, I'm sure this was an enormous implementation.
Yeah.
That would have spanned at least a year or two.
Yeah.
And again, so now, but that, okay, so you've made that decision, you've implemented it. Maybe it's not going right. Maybe they did do testing and they found something that wasn't quite right. But we've already sunk a few $1 million into this, haven't we? We're already on that process. So let's work through those issues. But this, I think, just goes to the root of this procurement problem. How do you find the right partner?
Yeah.
Right? With the software that does what you need it to do. And if you don't find the right partner, excuse me, you're going to find yourself going down these paths that don't always lead to a happy outcome. Yeah. And in this case, we talked about failed projects. This is a failed project that literally caused the company to go bankrupt.
Yeah.
Or at least according to them at this point.
Yeah, and it's catastrophic. I mean, it's a sad event. But yeah, it'll be interesting to see what more comes out of it. And obviously it'll probably be a couple years in the making of this lawsuit, since I know they just filed it. But again, this shows the pitfalls of procurement and how you have to find a place or find something that gives you the data you need to know it's the right fit. And you nailed it, Don.
These are critical decisions. And again, I know we put those numbers up there. And, when we were starting this company and looking at those numbers and going, in my personal experience, I've seen a lot of failures, and not just with my company, but with other projects and everything going on, and out there talking with different buyers in the space. They have horror stories too. And hopefully, in season 2 of this, we want to get buyers on into this discussion as well, and look at some of their horror stories. But at the end of the day, these are important decisions. Yeah. And it's with the way we're doing it today, you're not guaranteed a success. In fact, looking at the numbers, more than half of the time you're going to fail. And that's just unacceptable. Right. And this is, and in the bigger picture, right, this is two companies, a health system and a healthcare system software provider that are fighting this out. But the real loser in this whole equation are the people that are served by those healthcare facilities, right? That's a hospital that isn't open now somewhere. Mm-hmm. That's doctors that had to rearrange and move or whatever. So you've got, these have real world impacts beyond just kind of the procurement aspect. Yeah. And that's, I think, when we look at our mission, that, when people look at like, oh, we're trying to fix the procurement process, there's a bigger mission to that, which is we really want to make sure that people are finding the right solutions to be successful, because when they're successful, they're servicing their customers, and especially in the healthcare space, they're servicing patients, people who need help, people who need care. And so every business decision has, a ripple effect into the populations that are served, into people's health. And that's where it's super critical and super important that people have the right information and they find the right partner and they see the feedback and
Mhm.
ask those harder questions, right? And that's where I think we can help impact that. And we make that decision better, and then we make the buyers and vendors more successful, and we make their customers, you know, better off in the end.
Yeah, absolutely. Absolutely.
Awesome, Matt. I'm sure we'll be tracking this case over the next few years as it plays itself out.
Yeah.
I think this is a really great example of exactly why a system like the one we built is necessary. So
Yeah.
look forward to hearing more about this, and you know, as it plays out, and we'll definitely, you know, bring more of that information into this kind of discussion as it comes to light. So again, thanks, Matt.
Thank you.